Hello and welcome, ladies, and welcome back if you're one of my wonderful subscribers. If you're new here, my name is Jax, and this is where I've been sharing my infertility, IVF, adoption, pregnancy, and parenting journeys. This is my 20-week update. I'm so excited to be halfway there, and this week we are going over the good, the bad, and the ugly from my 20-week anatomy scan. As always, we'll start off with a quick update on how Beta Baby's doing, what they're up to. Right now, they are about 10 inches long, and they're about the size of an axolotl or an ear of corn. And we actually have more information. They are estimating a weight of 12 ounces this week from the anatomy scan. So it's fun to actually have real data and not just the average stuff. Oh, makes me so excited. But I won't get ahead of myself. We'll get to the ultrasound in a minute. They are, of course, continuing to grow and practice breathing and moving around a lot. But this week, they're also starting to get some eyebrows and eyelashes and things like that that are adding a little bit more to their personality, their appearance, and aren't quite as practical as, developing their lungs. And this week, I can actually show you a picture. See? I'll get you nice close-up pictures. But yeah, we went to the anatomy scan yesterday. So unlike most updates where I wait till the end of the week to film this one, I thought I would do it a little bit early so that you all could get the results of the anatomy scan. Of course, if you're over on my Instagram, you already know all of this. But I am so excited to share a lot of information that we got during that scan. Before we get into that whole anatomy scan update and kind of some footage I have from the day, I wanted to say my weight is about 150 and a half, so that is actually pretty good. That's a pound over the last 2 weeks, which is really solid. And my stomach is still measuring around 30 and a half-ish inches, and we'll do bump shots right now. All right, so this is from the side. This is from the front, the shirt on. This is from the front with the shirt off, and then from the side. So definitely looking a little different. All right, and without further ado, here is the vlog footage from the day of the ultrasound. Hey, what's up? Today I'm exactly 20 weeks. It's a big day. It's our anatomy scan, so we took the back half of the day off and are just waiting for it to be our appointment. So I thought I'd... What the hell was that? Oh. Can you see that? All of that just fell off our roof. Sorry, that was like scary. It sounded like, well, it sounded like a few pounds of snow falling off the roof. All right, let's try that again. That was weird and scary. We got a snowstorm a few days back here and everything is starting to melt and there's only a little bit left, so I'm surprised there was even that much snow on the roof to fall off. Anyway, what was I saying? We're killing time until our scan, but I thought I'd hop on and address something that came up a lot in the comments of last update. Last update I talked about my weight some more, and there was a lot of comments to the fact of, why are you even worried? No, I haven't gained this much, it's all fine. So I really appreciate you guys sharing your own stories, because first of all, there's not a lot of like content on the internet for like people that aren't going through this cute little linear weight growth, but I thought I would elaborate a little on why I'm fixated on that. It's not really about the weight, it's about how awful I am feeling and how nauseous. That's one point. It's not that I'm not gaining weight because that is what my body wants to do. It's because I am not eating enough, if that makes sense. Like, I am hungry. I feel some nutritional deficiencies and like cravings and stuff. So like when I talk about my weight, I really mean I would like to be able to eat 3 square meals a day, and just feel better. That's one thing. And the second thing is, since I do feel that some days I'm not getting enough to eat, and this has been going on for so long, it does nag at my mind that I'm concerned about Beta Baby and them growing, and that's why I'm hoping that this scan can really assuage some of those concerns of mine that they aren't growing. That's my other part of it. Like, I wouldn't be as concerned if I was eating what I want and I felt satiated and felt good about it, but I don't. And I would A, like to feel better, and B, like reassurance that Beta Baby is growing appropriately. And if they are, and that's what the scan shows, then I'll feel a lot better about it, knowing that my body is providing for them, even though I can't quite get what I need to eat. So yeah, that was the point of that. Like, please do not think like I'm weirdly obsessed about my weight. I was so ready to become like just a manatee during this pregnancy and just eat what I wanted, and my body has other plans, so I'm minorly frustrated about that. And mostly I'm just 5 months into not feeling great, so I would like to turn that around. Okay, that's all I wanted to say about that, is get that clarified. I will see you all again when it is time for our ultrasound. Hello ladies. We just got done the 20-week detailed anatomy scanny thing. And everything overall went well. There's a few things of note. One, Beta Baby was in like the complete wrong position. Like, it was clearly frustrating our sonographer, like a little bit how far down they were. So we did not get all the images we needed, especially around like the brain scans. But that's okay, because I have to go back for an echocardiogram in 4 weeks anyway, because it's an IVF pregnancy. So they said they'll pick up the images they need there. Other than that, they were just scrunched up the whole time with their hands and their feet right by their face, which was kind of cute. Got a rough measurement. They're measuring 12 ounces. So that's really good, considering my app says they should be like 10 or 11. So that really helps kind of with some of my fears that they weren't getting enough to eat, essentially, or grow fast enough, because I wasn't eating enough.
Nope.
No. So good. That's all I wanted, was to make sure that they're leeching off of me and that me feeling so bad wasn't affecting them. So that makes me feel better. And then there was not great news in that ultrasound. They did find, well, 2 things happened. One, they couldn't get the images they wanted, so they had to do a transvaginal ultrasound. Boo. Always not super fun. But because they did, they got a really good look at my placenta, which is really low-lying. In fact, it's actually a partial placenta previa. So, not great. Not awesome. And so we're going to have to watch that. But luckily we have this scan in 4 weeks, and I'm sure they'll keep monitoring it. The doctor mentioned by 28 weeks, a lot of people have them resolved. They're going to resolve, and all the way up to 32 weeks, they'll monitor it to see if it'll resolve. Because that would be a bummer. That would be a big birth plan change, to have to get a C-section at 36 weeks.
Yes.
That would kind of blow everything out of the water, and it'll have to kind of dictate us going forward now too, because we were going to consider different changes, and now we'll have to wait and see.
Yep.
So that was a minor bummer, but I'm just thankful that obviously we have the technology to like find it early on, so it's not like at delivery and you're bleeding and they don't know why. Obviously this is way better, and it is just partial, so there's a chance that it'll resolve, but that was kind of the only bummer, because it throws kind of a wrench in the plan. But I think of all the bad news we could have gotten, that's the best bad news you can get. So we did stop by McDonald's so I could get a slushie, because I've been wanting one for days, and then we got some french fries, because I'm pretty sure you're not allowed to leave McDonald's without french fries.
Right.
Right?
Yes.
Yes. Insta regret if you do that. So anyway, we have an hour or so before we have to go pick up Evie. I think we're gonna go home and chill. Yeah?
Yep.
Cool. Awesome. All right, back to the normal update. All right, so let's talk a little bit more in depth about everything that kind of got discovered in that. First and foremost, of course, the baby was looking great, other than looking up so that the sonographer couldn't get all of the shots that she needed. After trying a bunch of different positions and doing the transvaginal ultrasound and then trying on, the abdominal ultrasound again, we did get some of them, but that's okay. I have to go back for an echocardiogram in 4 weeks. They'll get the rest of the images then,
hopefully. But what was discovered during the transvaginal ultrasound, other than my cervix is a good length, yay, that's why you originally do those, was a marginal placenta previa. So if you're not familiar with that, a full placenta previa would be if this was your cervix, right, where the baby needs to come out. It's closed right now, but it needs to get big eventually. A full placenta previa would be if the placenta was sitting right on top of it. And this would be bad because this is what's giving blood supply to the baby. And then if you were to dilate and go into labor, the cervix would expand and disconnect all of those blood vessels, and then you'd have a lot of hemorrhaging, which would be bad for mom, and you'd cut off the blood supply to the baby, which would obviously be very dangerous for a baby. So that's a full one. That's not what I have. What I have is called a marginal placenta previa, where the placenta is encroaching. It's there. So a low-lying placenta would be way over there. Then we get the marginal, it kind of touches. And I could even see it on the ultrasound. You know, I'm not as familiar, obviously, with OB ultrasounds as I am with fertility ones. But I saw the placenta and I saw the cervix, and I was like, I feel like those shouldn't be so close. I feel like those are touching. That's not good. And sure enough, they were. Luckily, I went and did some research, and about 90% of marginal placenta previas resolve, and it is totally correlated to how close it is. Like, this obviously resolves way less of the time than this. And so that is just the correlation there, but a lot of them resolve. What we'll do, we'll keep an eye on it, and we don't have to make a call until week 32 on whether or not we schedule a C-section at week 36. Obviously, that's not what I want to do, but of all the bad news, this kind of, like I said, this is the best bad news you can get because it's not dangerous in the meantime, really, unless I was like really into rock climbing or like really into some vigorous exercise that I'd have to stop. But I'm not, obviously. So that's fine. And unless there's bleeding, then there's not, anything to really worry about. The majority of the placenta is very firmly attached and fine, and as long as the cervix doesn't dilate, it'll continue to stay that way. And now that we know about it, we can monitor it, and if it gets to a later point in pregnancy and it's still there, we can have a C-section and no harm done. Minus my abdomen getting cut open. A little bit of harm there. The other thing this really delightful doctor mentioned was that, and I have to say, the ultrasound tech, as much as she was like frustrated that baby wouldn't get in the right position, I think she was like, mostly she's just really into her job. And the fact that she couldn't make it happen was like personally frustrating to her. She was not mean or anything to us. She was just like, come on, like almost to herself. And she tried all these tricks and couldn't get baby to move. So I think she was mostly just frustrated that like her bag of tricks didn't work. Anyway, so she was nice. The doctor was absolutely delightful. She did mention I have a marginal insertion of the umbilical cord, which essentially, this is our placenta again, you would like the umbilical cord to be like right in the center or, right around the center, and that would all be fine. But mine's chilling out over here. And she said back in the day they would have been way more concerned about this, but time has kind of shown them that marginal cord insertions aren't a problem kind of until they're a problem. If there's no sign of lack of blood flow or not getting enough nutrition or placental abruption or anything like that, then they kind of just watch it and nothing usually comes of it, but it's just good to know. It is worth noting that placenta previa especially, and placenta abnormalities in general, are linked to IVF. So we'll never know if that was one of the factors in it, and they don't super understand 100% why this happens, but placenta previa is actually more common in IVF pregnancies. So I just thought that was an interesting fact that I stumbled upon. Okay, so we got the good, baby's looking great. We got the bad, placenta previa is not awesome, and then ugly. But it's the cute, because there's no ugly here, there's only cute. We got such cute ultrasound pictures, and I was so happy to get them. Obviously, this is the first time we've really gotten that quintessential baby profile picture, and you're not guaranteed those, by the way, at all. Like, your baby can always be looking directly at you or looking away, and so you're not guaranteed those during an anatomy scan. So I'm happy that we really got that quintessential photo. It really means a lot to me to have it, and to have a real baby picture to look at. So I really loved that part. I really loved getting to see them move around as well. It was crazy. As much as they would never get in the right position for the scans we needed, they were moving around a ton, which was just really cool to see. Because even though I can feel them occasionally, I don't know, I think in my head I was like, oh, maybe I'm insane. I don't know. Maybe I'm making this up. Maybe I just don't know what I'm feeling. And it was just really reassuring to see that they were okay and moving, and that they were the right size. That's something that I alluded to earlier. I was genuinely getting concerned that, like, me not getting enough to eat would translate into them not being big enough. But as my mother, Mama Kay, reminds me over and over again, she's like, a baby will leech from you. Always, always, always. Your body will always put that baby first and give them what they need and take it from you. Whether it's fat, minerals, or vitamins, like, they will take it from you. So it's I can't tell you. It was so reassuring to, like, get that news, to just know that it's okay, because that's just one big anxiety that is just gone, and it's fine. I go see my regular OB next week to review the results of that, although I assume it's going to be a pretty short meeting. I think we'll talk about the placenta previa issue a little bit more. Maybe I can get a little bit more information on kind of what category exactly I am in, because we didn't touch on that very much. We do have, like I said, an echocardiogram, because IVF babies have a slightly higher chance of heart defects. We do have that in 4 weeks. Finally, the husband update. I asked him what his favorite part of the scan was, and he said it was just really cool to see them move, because obviously he can't feel it yet. And then I just wanted to throw in here my little update on the husband that I think is cute, is that he has been putting way more effort into meal planning and cooking for us, because he wants, obviously Evangeline to eat well, but also for me to eat well, and it's like his little, like, part to contribute, especially because I'm so nauseous and so not into food. It's partially desperation on his part, because I'm not cooking, like, anything right now. But it's also, he's kind of really stepping it up, and instead of just, like, phoning it in food, he's actually trying to, like, improve our menu and improve the healthiness of our food. So, I don't know, that was just really sweet, because he's trying to contribute to me and the baby and to Evangeline. So, we're eating well this week, that's for sure. All right, next time you see me will be for the rules and prizes for the baby name reveal contest. That'll be this Thursday. I'm so looking forward to it. And until next time, ladies, keep on fighting. Mwah!